Well, COVID-19 screening and testing is being intensified in Nelson Mandela Bay, that's in the Eastern Cape. That region is currently seeing an increase in new infections. Health Minister Dr Zweli Mkhize has been warning that if nothing drastic is done, the situation could result in full-blown resurgence. Well, Newzroom Africa's Malungelo Booi is in the township of Woma, that's in the Port Elizabeth region or Port Elizabeth city. Malu, good morning to you. The minister there highlighting when he arrived that the issue of parties, especially by young people, is one of those that are to blame for the cluster outbreaks. What is being done to stop the parties?
That's right, Booi. Perhaps let's locate ourselves where we rise. You rightfully said we're in Woma. In fact, we're in one of the local clinics where officials from the health department are actually launching something that's called rapid screening and testing for COVID-19. We've seen them earlier on moving around this particular township using loud hailers, inviting people to come into this clinic so that they can be screened and tested for COVID-19. You'd ask why? Well, Woma Township is one of those areas that has been flagged as a hotspot in the Nelson Mandela Bay municipality, and that's why we're currently seeing authorities sort of like pushing hard in making sure that people are screened and tested for COVID-19. I do want us to quickly go and listen to what the health MEC in this province is actually currently saying. She's briefing some of my colleagues. I want us to just quickly listen in at what she's saying.
But we are no more having the issue of reagents that we used to have. We are now stocked well and we are okay.
Aren't these systems, 15-minute rapid testing systems, they use at the hospitals where we're here? There's of course the backlog of test results coming back.
The reason why we are here today, we are launching the rapid results system. It has not been on and now it's on. So even in hospitals, I'll do the same thing. It is still NHLS that is here, that is doing the rapid system. It was still NHLS that was doing the other system, which was 48 to 72 hours.
Can this system be trusted, MEC?
I've gone in and I've looked at the system and how it's working, and I've seen that it works specifically or equally like an AIDS rapid test would, or equally a home pregnancy test would, where you see the line, and when that line does not actually get to be a second line, then the person is negative. Once those lines then are joined and there's two lines, then it says there is the virus.
MEC, does then this mean that, people come in and test and they get their results there and then?
Yes, they do. That is why we've got a special room and counsellors that when we see the results, we either tell them that they're negative and release them, but if we find them positive, we call them aside, try and get their families, talk to the issue, counsel them, and make them make choices that now the condition is like this. But majority of them, we take them into the field hospital for isolation.
All right, Booi, that's the health MEC here in the Eastern Cape, actually addressing journalists, explaining what this rapid testing and screening is all about. And that's actually quite important, and that's something, Booi, that the Health Minister, Dr Zweli Mkhize, alluded to yesterday, saying that what he wanted to see the Eastern Cape doing, wanted to see the Eastern Cape being aggressive to its response to this so-called peak of new infections, especially here in Port Elizabeth. You spoke about the issue of parties, Booi, earlier on. You're right, and it's one of the things that has also been spoken about. Looking at the numbers of the people and the age group of the people that is actually getting infected with this virus, we have been told that it's economically active people and it's young people like me and you, Booi. And of course, authorities saying that they also need to deal with that. But they've also said, Booi, that one of the reasons they're also seeing a peak in COVID-19, especially in the Nelson Mandela Bay region, is that businesses like taverns are essentially not playing their part in ensuring that people do social distance and also wear masks when they essentially come in. In fact, there was a call that was made yesterday by the minister that if businesses don't adhere to those lockdown regulations and safety protocols, those businesses should simply be closed down.
Yeah, Malu, and you are in Port Elizabeth, and sad news coming from that particular city, and that is that the former mayor of Nelson Mandela Bay, Mongameli Bobane, died, and we understand it was due to COVID-19 complications. Malu, talk to us about the strategy going forward. So the MEC is outlining this strategy, but she has a massive problem in her hands, and that is staff who are demoralized because they're saying they overworked and underpaid. I was listening to your story last night.
That's right, Koli. I mean, the issue here in the Eastern Cape is actually quite complex. Bear in mind, this province is actually quite vast, but if we bring things here in Port Elizabeth or in the Nelson Mandela Bay municipality, we've heard yesterday, from officials saying that some of their staff members are already showing signs of fatigue. In fact, some of them are actually infected by this virus. Officials are saying that already this month or in the past few weeks, they've registered about 140 healthcare workers that have tested positive for COVID-19. So what does that mean or say? Essentially, it means, those 140 healthcare workers are actually off the system for those 10 to 14 days until they're fully recovered, and then they go back. But we've heard the minister yesterday saying that, look, he wanted a report from health authorities in this particular province to tell him about the staff shortages or staff challenges that they may have, so that those particular challenges can actually be solved. But we also heard him also saying that, there's a possibility of bringing in more Cuban doctors in this particular region and this particular province to assist, health officials here so that they can be able to deal with this peak of new infections here in the Nelson Mandela Bay and also in the Sarah Baartman district municipality. The interesting thing, though, about Sarah Baartman district municipality, it's a municipality that consists of about 7 local municipalities. Those local municipalities include Ndlambe, which is in Port Alfred, include Imakana, which is in Grahamstown. So Ndlambe is a tourist town and Grahamstown is a university town. And we have heard that the cases there in Grahamstown have also gone up a bit because there was an event there that led to people contracting, COVID-19. And of course, authorities again sounding alarm, saying that if something is not done drastically, what we're currently seeing here in the Nelson Mandela Bay region is likely to become a full-blown resurgence of COVID-19.
And that's the worry for health authorities in the country. Malungelo, Booi, thank you very much for that update. I mean, you start to wonder what is going on in the Eastern Cape. When this COVID-19 issue came up some time ago, right at the beginning in March, the issue of funerals, people being urged, please do not attend funerals because that's where cluster outbreaks result. Ultimately, people did listen, but now it's parties. What needs to be done about the Eastern Cape?